Benco Dental, a national leading company, helped us with the equipment here. So what we have is the top of the line equipment here, where the massage, the patients typically they are sitting in the chair from 7 in the morning till 5 in the evening to get their full mouth dental implant work and reconstructive work done. So their comfort is the highest priority for our team. So we ensure that everything is taken care of. And also, if you notice, we have a rear side delivery. So we have what's called a four-handed dentistry, where the doctor sits here. You can be the right-handed or left-handed, and the assistant is on the other side. And we have all the equipment in the back. So the patient's not aware what's all going on behind him. So this is called a 12 o'clock configuration. And then everything is digital here. We have a digital x-rays, which is like 98% less radiation. So I can be here while the x-rays are being shot, and then I can actually show on the monitor here as the x-rays are pulled up, and we can explain the treatment plan to the client so he can understand what are all the different options. So they don't need to get up and go anywhere else. So typically when there is a problem with the gum disease, we will be able to pull up the chart right here, explain to the patient that this is what needs to be done, and majority of the time they will go ahead, give a thumbs up, so we get started with the work. So technology and having office set up to date and having a state of the art equipment helps you to provide a better patient care delivery. So that's something over here. And then I would like you to take a look at the Solaris. This is called the Solaris Sterilization Center. This is state of the art, the first one of its kind of machine installed in the entire nation. This is basically, it's a 100% spore killing mechanism. Everything's automated. Yeah. So with hands-free mechanism, when my assistant is going to finish when I finish any procedure, they can come in, and when they touch it, these doors pop up automatically. So I don't need to even touch this. So just by hitting that, the doors pop up. I know the systems are down now, so they're not going to show up, but they pop up, and then red indicates all dirty. So everything, blood soaked instruments, they all go in on the left side, and we run through the ultrasonics here, and pretty much with the sweep zone, we time it, so all the machines, instruments, they all get rinsed out, and then we do packaging of all the instruments, and then even the hand pieces. This is called a cavoclave. So we put all the hand pieces in here, and then we make sure every instrument is 100% sterilized. So that's on top of it, we run all the items through the autoclave. So once after it's done, the blue indicates that's clean. So we call it a ultraviolet cleaning. So all the instruments are wrapped, and they are pretty much ready to be set up for the next day procedure. The assistants, they wrap that up and everything. So once this is set up, so we are ready for the next day. So all the instruments, they are put in color-coded trays. In color-coded trays, we have blue, purple, yellow. So they are color-coded for a particular procedure. All the equipment is set up, and the assistant comes in, and then she's going to go ahead and stack them. So blue indicates exam. For a surgical, we use the purple, and we use color-coded trays. So the efficiency increases. So once everything is put in, so as the procedure is going on, they don't have to leave the operatory, the surgical assistant, to get anything. Everything is available right inside the operatory. So that improves the efficiency and also provides better care to the customer. The patient's very happy that we are not leaving them and having to go out. So that's the design aspect of this. So we call these two as the doctor operatories, and those two bays, we are the hygiene base, where we clean and do the gum cleaning and so forth. So as I said, every operatory can be used for any procedure. Like all operatories are designed similarly, they are stocked similarly, and they are equipped similarly such a way that any of one of our doctors who come and work in this location, they know exactly, they can walk into any room and perform any procedure that the patient's looking for.
ఎంతమంది డాక్టర్స్ వర్క్ చేస్తారు?
We are totally 4 doctors. Giving just a brief history, we are totally 4 doctors. Giving just a brief history, this is the first location that was started, Universal Smiles, and we have 2 other locations in Orange City and also in Edgewater, which is New Smyrna Beach. So we have Dr. McCreary, Dr. Anthony Deere is still part-time, Dr. Nadej Sherry from Jacksonville, she's on board, and Dr. Wendy Westbury is our newest doctor who joined our team recently. So all the doctors rotate between different locations, and we are Monday through Friday, and we are hoping by end of March we will be 7 to 7. That's going to be our newest theme for the 2016, which is will be open 7 days a week, 7 a.m. to 7 p.m. So clients can pick their slots. They don't need to get off the work, or they can come in early, get their cleanings done, and then go back to the office, if you will, or evenings, come back after hours and get the work done. Starbase Dental was founded back in 1993. The office and the theme was all featured in the movie Trekkies, that was in Sand Lake Road by Dr. Phillips Hospital. And I took it over back in 2004 from Dr. Dennis Bourguignon. As the captain retired, I became the captain S. And from there on, we added more locations, more doctors, and we kept growing. And patient care, and so this is our hygiene base, and we do offer Zoom whitening, and I'm going to show that whitening. Basically, it's a laser whitening procedure. We have one of these lights. We apply some gel and then use the ultraviolet light to clean the teeth. And to show the x-rays, how that works, so typically most offices, they have to go. When we have a patient in the chair, instead of having to move them to different operatories, we'll be able to take the digital x-rays right here. So the same arm can swing on the opposite side. So we'll be taking the pictures, and also have an intraoral camera. I'm going to show you in just a minute. So with the intraoral camera, we are going to take a picture and show how much the resolution is. So you could actually see, we just take the pictures to show exactly how the before and after looks for the patient. So this is how her smile was before, when she started, one of my favorite patients, Jerry. And then once she is done in 2 visits, this is how she's looking. So that's what we call it as a cosmetic dentistry. So we will be able to show the same case to another prospective patient who is wanting to change the smile. So this technology, what we have, is so useful to educate the patients about how they can have a smile that they have been dreaming of. So there's several procedures. For example, we do the implants. Someone can come in, they can go for something like this here, with all the teeth that are decayed, with several years of dental neglect, and they can come in, and basically they can have a smile, something that can change them. And they just keep dancing once they have that beautiful smile. So typically when a client comes in, we show how the work can be done in different phases. So here you see one of a billionaire. He's a billionaire from England. He owns multiple businesses there, and he has no time. He got his plastic surgery done, so he wants to get his teeth fixed. So, and he cannot afford to spend more time being here. So what we do is called a diagnostic wax up, to show him how, so that's the final smile, how it can be corrected. So that's what's called the cosmetic dentistry. In the form of veneers, we'll be able to explain everything that we can straighten with the veneers treatment. these are the porcelain veneers, we can change the smile of an individual in a very short span of time. So there are several options that people can pick depending on what area they are going to. Typically we use orthodontics like traditional braces or Invisalign to straighten the teeth, and people, if they don't have the time, we can always offer cosmetic veneers by doing what we call diagnostic wax up, and then we will be able to pick a very nice shade after the zoom whitening. So the next feature of Universal Smiles technology is the chair-side CAD/CAM dentistry. So we have a machine which is called an E4D machine, which is similar to CEREC. So what we do with this machine, we can design your smile with veneers. So if you have a broken tooth, or you have a crown that's needed, you don't have to have multiple visits. In the same visit, we can prepare the tooth, have this machine. So we use what's called a scanner to take pictures of the teeth, multiple pictures, design the tooth, and have the patient get them involved in the smile design process. And then once the smile is done, we have a milling machine right behind you, and I can send that image over here, and in approximately 19 minutes we can mill the particular veneer or the crown right here. So basically this is what we call as a porcelain block. This is a porcelain block by Emax. It's called by Ivoclar is the company. So we basically place this right here inside the machine, and the porcelain block turns into a crown, and then based off of the shade we program it in the computer system here, so we can get an appropriate color. So the cases that you were seeing were all milled just like the one that we are showing. So this is what's called a same day dentistry. So this is one of the features that we offer here. So moving on, again, like I said, this is one example that shows. This is the traditional braces, where you can have all the multiple wires, do it in the traditional way, or you could go wireless by using clear acrylic trays for Invisalign. So that's one another thing. We use a world famous dental laboratory for big full mouth cases, that's in California, Los Angeles, California. So the biotems, they basically are the ones, they provide us the temporaries, especially when we are dealing with full mouth reconstructive cases. So anytime the patients, they need full mouth of reconstructive work, they can go through these several steps. We can talk about that later. That's pretty much all the operators we have, and this is what is called our ready room. When the patient is wanting to discuss their financial options, right? So my financial coordinator brings the patient into this room, and we give them a heads up to say, this is where we're going to talk about the money and the different options. So as the client comes in, so typically they get seated right here. So we bring them, the client is seated, we will explain everything, and then we show on video right here on the monitor here the different options of what are all the different kinds of crowns and how the procedure is going to be done. And then not only that, we discuss about all the different treatment options. So the patient's well aware of how much time it's going to take to do an implant, or to do a crown or a bridge or a root canal or whatnot. So this is what's called the ready room. So in the ready room we use this to help the patients get complete education of what needs to be done. So that's this part of it. And then let me show you the E4D lab. This is where we call it E4D lab, and we use it saying crew members only. So right here we use this to stain, for stain the veneers. This is where we use all the laboratory equipment. And here we use what's called a cone beam scan machine. So anytime we were to do an implant, full mouth implants, we do a cone beam, and with the cone beam we can assess the density and the quality of the bone. So that's a very, very helpful tool for doing advanced implant cases and sinus lifts. And not only for the implant surgeries, we could use it for orthodontic evaluation also. and endodontics, where we can check the root configurations, and that's going to help one of the doctors. I don't do root canals, but anybody who does, they would use that to do a very good root canal procedure.